Hey everybody, my name's Alfredo, and my partner AJ and myself will be demonstrating how to do some x-rays on a knee with some special views. So we will start with a AP projection of the knee, also a AP oblique projection with internal rotation, a lateral projection of a knee, and we will also be doing PA axial, or a tunnel view I should say, and a tangential patella. So hang tight. Alright, so for our AP, our external oblique, and our internal obliques, we're going to go ahead and set it up here at 75 at 5. For our lateral, we're going to want to kick it up a little bit. Might want to go like 75 at 6.4. We'll see. We'll adjust it once we see our patient. But make sure you're on table bookie, fixed AEC, and what you want to do as well, because it is a knee in an orthopedic, you want to go ahead and set up your focal spot in the small focal spot. You get the most recorded detail, which will benefit you and get you the best information possible. So let's go ahead and get our patient, all right? So now that we've retrieved our patient, we're going to go ahead and get a brief history, as well as make sure you double ID your patient to correctly identify that is the patient that you want. So you want to get the full name and also a birth date. If our patient was a female, for example, in this case it's a male, but if it was a female, you'd want to make sure that they are not pregnant, and you can continue from there. So we'll go ahead and retrieve our patient now. Our patient today is Mr. Clevenger. Please come on in. Hello, sir. How are you doing today?
Pretty good.
All right. So, Mr. Clevenger, could I please get your full name and your date of birth, please?
Sure. My full name is Arsenio Angine Imperio Clevenger, and my birthday is July 7th, 1983.
All right. Perfect. And I understand we are x-raying your knee today, correct?
Oh, yes, please.
All right. And can you tell me a little bit about what happened?
Oh, yeah. I was putting on some knee pads earlier, and, one of the knee pads don't work really well, so I was playing some softball.
I see. All right. So injured?
And,
sports injury?
Yeah, I found my right knee.
Okay.
I was trying to slide into first base.
Okay. I see. So obtaining a good history is always very important. It'll help your radiologist understand exactly what's happening and get the patient the best service that they could possibly have. If Mr. Clevenger was a woman, then we would ask if he was pregnant, or if she was pregnant. But sir, are you currently pregnant?
Not today.
Not today. Okay. So that's it. So we're gonna go ahead and get started. All right. Now that we have retrieved our patient, our first shot will be the AP projection shot of the knee. Have your patient lay supine on the table with the affected leg fully extended. You will have a degree of angulation on your tube, which will vary depending on the degree of thickness between the as-is and the table between your patient. For this particular patient, since we measure right at 24 centimeters, we will give him a 5-degree cephalic angulation. You want to make sure that there is no rotation of the body part and that you are centered right at the mid-sagittal plane of the knee. Perfect. You also want to make sure you collimate down to only the parts that you need. This will help reduce unnecessary patient exposure and will give you the best contrast that you can have. Include your marker in your collimated field and make sure that it is anatomically correct, as this is a left knee. Our center ray will enter 1/2 inch below the patellar apex. For our next shot, we will have the patient rotate slightly, internally rotate his knee 45 degrees. We will maintain our 5-degree cephalic angulation of our tube throughout the shots of the knee. Our center ray will enter at 1/2 inch below the patellar apex. Make sure you collimate down to only the field that you need and that your marker is free of the anatomy. For our next shot, it requires our patient to lay on the affected side with their knee bent at a 30-degree angle. This is known as a lateral projection or medial lateral shot. We want our center ray to enter at the level of the epicondyles or the condyles of the femur. Here we go. You also want some light around the area. Make sure that your patient's leg is not rotated internally or externally more than it has to. You want your condyles to be superimposed, and over rotation will cause them to not be perfectly superimposed. Collimate to the area that you need and make sure your marker is anatomically correct. Our next image is a tangential projection or the Setagast method for the patella and the patellofemoral joint. For this projection, your patient will be laying supine and will also be holding the image receptor with one hand. Your center ray will enter between the patellofemoral joint. This will show the patella free of superimposition from the condyles and the femur. Match your degree of angle on your tube to the degree of angle on your patient's leg or the upper portion of the femur. Our final image will be the PA axial projection or the Camp-Coventry method, which shows the intercondylar fossa or the tunnel view. For this, you want to angle your central ray 40 degrees axial to the patellar joint. You want to elevate your patient's leg around 40 degrees and have some support as well. So collimate to the area needed and have your marker anatomically correct and free of the anatomy. Hey guys, so now we're back and we're going to go ahead and we're going to take a look at our images that we got. So this is our AP knee that we're going to be taking a look at. So you want to look for a few things here when you're critiquing what you have here. You want to make sure you include the soft tissue around the area. That's just in case of any swelling or trauma to the area. You want to make sure you include that. You'll see some swelling there. Let's go ahead and take a quick little look here. Your patella is going to be superimposed right in the center of your femur, which is what you want. That right there is a good shot. You want to include even spaces here on a healthy knee. So you're going to have equal spaces there, and your tibial plateaus are going to be here. You have your medial and your lateral plateaus, which look good here. Your intercondylar eminences, they're right here in the middle. That right there looks good. You also want to make sure that you have your fibula head right there slightly superimposed with the tibia. You got your marker well out of the anatomy. Collimation is good. Your technique here looks good. And that right there looks good for an AP. So we'll go ahead and take a look at some other ones. Guys, and we're back, so we're going to go ahead and take a look at our internal oblique AP knee, which we did earlier. On this one, what you want to do, you want to pretty much include most of the stuff we included on our AP. We got soft tissue here, which is what you want to see. But on this one, a main difference that will help you distinguish it, you do have separation on an oblique of the tibiofibular articulation joints, which would be this one right here, and you can see it fairly clearly. You got your tibia here, your fibula here, and then you have your articulation joint coming right in here. Your lateral tibial plateau would be shown here in profile, and your medial would be right over here on this side. Your patella will not be perfectly superimposed above the femur. It will actually be, what you want to see is about a third of it coming out, like about a third of the shadow coming off of the femur here, which is what you want to see. We can tell that it's a internal rotation, since you can see if it was a external rotation, your tibia and your fibula would be more superimposed than they are here. Right here, they're not superimposed at all. So this is a good shot that we had. We have our left marker here out of the anatomy, but yet nice in here. And we included enough of the tib fib and the femur, and that right there looks like a good shot. So we'll go ahead and move on to the next one. Alright guys, so now we're back. We're going to be critiquing our left lateral knee, which we did earlier. On this one, what you want to see is you want to see the femur, the patella, and the tibia in a lateral profile. You want to make sure you include all soft tissue around the area. Like we mentioned earlier, any trauma or such to the site would cause inflammation. You'll be able to see it here in the soft tissues. You want to see your patella in a lateral profile. You also want to see the patellofemoral joint space, which would be this one right here. You want to see that nice and open, which we have that there. Your condyles are nice and superimposed of each other and not rotated. That'll show no rotation of the knee. You want to see some slight superimposition of your tibia, your fibula on this side here. So the head right here slightly superimposed. You want to see your tibiofemoral joint space nice and open. Right here, see nice and open. You can see right through. That right there looks good. We have our marker here, left marker, marking the anatomy. And I believe that's it. We have enough of all the anatomy here to say that we have a good X-ray. You also want your knee flexed at a 20 to 30 degree angle. Ideally, as much as the patient can flex it, but 20 to 30 degrees is sufficient. And that is our lateral knee. Alright, so now we're back and we're going to take a look at our tangential patella, which was our Sedegas method that we did, our sunrise. So with this one, what you want to see is, you want to see the nice patellofemoral joint space open here and your patella free of superimposition from anything. So it's pretty much just floating all in space by itself. You got your condyles here, which is nice on your femur, and your patella is nice and floating by itself. You got your marker up here, up on the screen here, large left. So that right there looks good. Our contrast is good. Collimation was good, and I believe got a good shot. All right, so we're going to critique our last one of our series here. This one is our Cumbentree method, or the tunnel view of the intercondylar fossa that we have. What you want to see here on this shot, you want to make sure that your patella is well superimposed over the femur, right here, just like in the AP. The only difference is that this tunnel here, the tunnel view, or the intercondylar fossa, will be elongated, and that is due to your 40-degree angle that you put on your tube as we or that we put in our tube as we took the image. This will give you a clear view of the tibial plateaus and also each individual tubercle. So the medial and the lateral tubercle will show up here, nice and open, and or if you want to refer to them as the intercondylar eminences, I mean it's the same thing, just tubercles are individual. You want to see slight superimposition of your tibia and your fibula, and no rotation on your condyles. Markers nice and out of the way, nice collimation. I think we have a winner here. Good shot. So hope you enjoyed it.